Time for some more female power on the virtual stage. Our next team is actually one of the youngest teams in our incubator, and these three formidable founders, Anna Katarina, Isabel, sorry, and Adelina, are they more than make up for the fact that they're one of the youngest teams. They're actually also one of the most international teams. There's founders with backgrounds with Brazilian background, Portuguese background, and there's Belgian background in there as well. And you'll be able to ask them some questions like you've been doing. You've been doing a great job so far. So I'm going to give Inu Health 4 minutes to pitch, and then we'll have 4 minutes to answer their questions. Inu Health, take it away.
Thank you, Justin, for this lovely introduction. Hi, I'm Isabel, and we are Inu. I would like to talk to you about a disease that affects 1 in 10 women worldwide. It's extremely painful. There is, as of yet, no cure, and it takes on average 10 years to be diagnosed. I'm talking about endometriosis, which is the abnormal growth of cells outside of the uterus. How many of you have heard of this before? I would like to introduce to you my co-founder, Adeline. Adeline was diagnosed 2 years ago after 17 years of pain. She had surgery to remove the cells, and still, the endo came back. Adeline has inspired us, and during our 50 customer interviews, we realized that most of the women had the wish to reconnect with their bodies and manage their endometriosis naturally. So we dove into our mission to empower women with endometriosis to thrive through the disease. Let me introduce to you Inu, the personal support for women with endometriosis. We aim to bring down the shame and lower down the barrier to seek specialist advice early, and provide them with holistic solutions to reduce the pain. We hope to make women make peace with their bodies. So how does it work? First, we provide a symptom tracker that that looks at the symptoms of endometriosis specifically, and then offers an analysis which can be shared with doctors or partners. Also, we offer a 28 days cognitive behavioral therapy program divided in daily sessions of 15 minutes, which has been clinically proven to increase quality of life. And furthermore, we provide information about anti-inflammatory nutrition, which can help to mitigate endometriosis symptoms.
So the pain out there is big, and there are already small companies trying to solve this. But we innovate by being the first one providing actionable and practical holistic solutions that are backed by science and offering long-term support and relationship. Just like Justin said, although VHP started in March, the adventure at Inu started only 4 months ago when these two amazing girls joined me. My name is Katarina, and I myself have over 5 years of experience in the healthcare and startup scene. The core team spans the experience between healthcare, economics, science, and marketing. Now we are backed by women and manpower in the design and technical team. We have a huge supportive network whose expertise goes through finance, medical, menstrual health space, and startup. And in these 4 months of incredible ride, we've made miracles out of limited resources. Now we established several partnerships for the product development, research, and marketing, culminating with collaborations with influencers and other startups. We have already a customer base of 90 women willing to pay for the app, and we can't thank our community enough. They have been a real brand advocate, spreading through social media a lot. And because inspiration, the same as love, grows if shared, we love to involve them in our marketing campaigns as well. From self-love to body positivity to podcasts with entrepreneurs that build their own business despite the disease. So we're aiming to convert 4% of the 2.7 million women that are suffering from endometriosis in Germany by 2023. We are launching our MVP in January 2021, and we have a direct-to-consumer approach with a subscription model of $59.99 per year. After 2 years, we aim to enter DIGA already with a revenue of 1.4 million. We are rise up to the uterus deck. We are looking for 500K of seed funding and also endometriosis clinics to start our research. If you have any questions, please do it now, or look after to the women with the yellow sweater. Thank you.
Thank you very much. quick question for you. How well is the CBT approach scientifically proven for endometriosis?
So the problem is the topic of endometriosis is underrepresented in the medical and scientific field. When we established the partnership with the University of Melbourne, they tested our CBT program in chronic pelvic pain patients. However, pelvic pain is the main symptom in 90% of women that have endometriosis. So we are aiming to bring this to this niche market, and we tested already in 20 women, and they all perceive the content of our audio CBT as helpful for their pain.
And so you showed some of your some of the other solutions. How does your solution differ from the others?
So the thing is, there's no solution right now that offers holistic solutions that are backed up by science. So we're going to be the one that is medical certified and enter DIGA. And secondly, they are expensive and they don't offer long-term support. So we are aiming to be the companion of women with endometriosis.
Excellent. Now, so what's next in your startup journey?
So we are launching the MVP by January 2021, and we, for the first 2 years, we want to test the validation of the product and try and go to medical certification class 1, and prepare everything to enter DIGA by 2023. Of course, alongside, we want to raise this awareness of misinformation, break this vicious cycle of misinformation around our menstrual symptoms, so we will have a powerful voice through marketing.
Now, one of our audience members asks what you're going to do with the pre-seed funding that you're asking for.
So it's for hiring and onboarding, for research studies. It's used also for the marketing campaigns to roll the pipeline, and also for the development of the product.
And what's been your biggest challenge throughout the incubation period?
As like you said, we started 4 months ago. So the biggest challenge is how to bring to the next level all of this, this important mission that all of us resonate so much. Definitely, but I also hopefully, even though there's 4 months, we achieved so much, and hopefully it inputs in all of you the spirit of resilience. If you believe in your idea and your mission, just go for it and don't stop. And that's what we did so far. We overcome all the challenges of such a short notice, so I'm happy where we are at.
Yeah, it seems like you're really, really far along for a team that's only been going for 4 months. It's quite incredible, and I'm guessing you must have been somewhat happy to hear that the incubator period was extended due to Corona from 9 months to 11 months, right? Or I don't know. What was your reaction to that?
Oh my God! Yes, I mean, absolutely. I mean, but of course. Unfortunately, due to Corona, that limited us in so many levels. But fortunately, it helped us go along in this project and offers us support for more 2 months. But we are happy for it.
Well, thank you so much, and thank you for sharing and answering the questions.